This product is used to treat lice, which are small insects that can infest and irritate the scalp, pubic area, or body. Rid shampoo works by paralyzing and killing lice. When using Rid shampoo, it's important to carefully follow the instructions provided by the manufacturer. Only use the medication on the outside of the body and avoid contact with the eyes, nose, mouth, or vagina. If the product does come into contact with these areas, rinse with plenty of water. Do not use the shampoo on eyelashes or eyebrows, and if using on an infant, be sure to cover their hands and feet to avoid ingestion. Make sure to apply the shampoo in a well-ventilated area, such as near an open window. Thoroughly cover the affected area with the shampoo, leave it on for about 10 minutes or as directed by your doctor, then rinse and dry the hair. Use a nit removal comb to remove any lice eggs from the hair, and wash your hands immediately after use. Since the shampoo does not affect lice eggs, it's important to repeat the application 7 to 10 days later to ensure any newly hatched lice are killed. If your condition does not improve after 2 treatments, be sure to consult your doctor. If you experience skin irritation, it's important to consult your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Serious allergic reactions to this drug are rare, but if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. In the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using Rid shampoo, make sure to inform your doctor or pharmacist if you are allergic to pyrethrins/piperonyl butoxide, chrysanthemum, or ragweed, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, before using this medication, be sure to inform your doctor or pharmacist about your medical history, particularly if you have any skin infections. If you experience constant or hard scratching of the skin or scalp, it may lead to a bacterial skin infection. Be sure to tell your doctor right away if you develop worsening redness or pus. If you are pregnant, it's important to use this medication only when clearly needed and to discuss the risks and benefits with your doctor. Additionally, it is currently unknown if this drug passes into breast milk, so it's best to consult your doctor before breastfeeding while using Rid shampoo. When using Rid shampoo, it is important to be aware of potential drug interactions. Certain medications may interact with Rid shampoo, affecting how it works and increasing the risk of serious side effects. It is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before using Rid shampoo if you are taking other medications to ensure safety and effectiveness. If Rid shampoo is inhaled or swallowed, it can be harmful. If someone has taken too much and experiences severe symptoms such as passing out or having difficulty breathing, it's important to call 911 or a poison control center immediately. In the US, residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, diarrhea, and unusual drowsiness. Remember to use Rid shampoo as directed and keep it out of reach of children to prevent accidental ingestion. When using Rid shampoo, it's important to take steps to prevent spreading lice to others or getting reinfested. This includes washing and drying all headwear, scarves, coats, and bed linens with hot water and high heat, as well as cleaning brushes and combs with hot water or alcohol. It's also important to check close contacts for lice and nits, and consider treatment even if live lice are not found on them. If you forget to use Rid shampoo, it's important to talk to your doctor or pharmacist for guidance. It's important to store Rid shampoo at room temperature and avoid freezing it. Keep it away from children and pets to prevent any accidental ingestion. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. Remember not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.